everyone, my name is Trace Mangan, and today I'm going to talk to you about my client, JC. JC is a 26-year-old who identifies as female and uses the pronoun she, her. She lives in Broome County, New York, which is considered upstate New York. She is of mixed race, African American and Caucasian. She is not of Hispanic or Latino ethnicity. She is a single mother of 2 young children, and she identifies as bisexual, although her current partner is a woman. JC lives in an apartment complex designed as low-income housing with her partner and 2 children. She resides in a multi-unit apartment building that contains at least 3 apartments. The complexes themselves, there's 4 buildings in total, and they each have 3 units in them. JC believes that her health is good. She doesn't really have any medical issues other than GERD, or gastroesophageal reflux disease. She does have mental health issues. She suffers from anxiety, depression, and PTSD, or post-traumatic stress disorder. She has a history of tonsil stones until her tonsils were removed. She also has a prior diagnosis of obesity. However, she started making better choices in her food and started exercising in the gym. So she's lost weight and gained muscle. Her past surgical history is a tonsillectomy due to frequent infections from tonsil stones. Due to her history and her family history of stomach complications, she has had an upper GI endoscopy to monitor her GERD, check for stomach acid erosion, and other possible stomach issues like Barrett's esophagus. She has had a colonoscopy to check for polyps since she has a family history of colon cancer. One of her siblings actually died from colon cancer when she was 31 years old. She gets a screening done every 5 years so the doctor can assess her for the need for a colonoscopy. She has 13 siblings, 7 sisters, and 6 brothers. She is the 3rd youngest child of her mom's 12 kids and the 3rd child of her father's 4 kids. And like I said, one of her siblings died from colon cancer. All of her siblings and her parents suffer from some sort of mental health issue. Most are anxiety and depression. However, one of her siblings is schizophrenic. It's primarily drug-induced schizophrenia. A couple of her siblings are bipolar. Some suffer from OCD, personality disorders, and eating disorders. Her father suffers from hypertension, high cholesterol, and COPD. And she also has another sibling that has a heart issue, but she's not sure of the specific heart issue. Sorry, excuse me. The review of her systems was unremarkable. Her weight has only changed due to her changes in her diet and exercise routine. She has no signs or symptoms of any illnesses. Her skin is unremarkable, other than acne breakouts, which are minimal. She also has had no issues with rashes, itching, or any other skin lesions. Her head, eyes, ears, nose, and throat show no issues. She, like I said before, she did have tonsil stones, but since she had a tonsillectomy, she doesn't have any issues with her tonsils anymore. Her cardiovascular system, she's had no issues with. and everything was within normal limits. Her respiratory system was unremarkable with no issues. Her gastrointestinal, she suffers from GERD, but as long as she takes her medication, then she doesn't have any problems. I'm sorry, guys. I think her kids got me sick, actually. Her genitourinary was unremarkable and everything was within normal limits. Her musculoskeletal is unremarkable. She does have some aches and pains, but they are attributed to her working out at the gym. Neurological, she has no issues with, and everything is within normal limits. She did have an issue when she was a child. She was diagnosed with absent seizures, but the doctor said that she outgrew them. Her psychiatric, we've talked about, she suffers from anxiety, depression, and PTSD. Her endocrine system, she has no issues with. Her hematological or lymphatic, she has not had any issues with. Everything there has been within normal limits based on her most recent lab work. Her only allergy is to Zithromax or erythromycin, and that's it. She doesn't have any food or environmental allergies. The social determinant of health that I believe affects JC the most is economic instability. JC is self-employed as a hair braider, which means she does not have health insurance aside from Medicaid. Her income varies from week to week depending on the number of appointments she has and the services that those people want. Additionally, she rents a booth in the shop, so it is necessary that she earns enough to cover the booth rental. So based on this, I would classify her as low income. An area of opportunity for nursing practice is addressing the stigma in mental health care. The impact on nursing practice includes integrating culturally competent education strategies, which empower nurses to reduce barriers to treatment and improve patient trust. Another area would be to lead in teaching JC digital literacy by using wearable devices and ensuring equitable access to telehealth, especially when it comes to her mental health. I would want to show her how to find a therapist online so that if she's unable to make an appointment in person, she could still get the help she needs with her mental health. This assignment has helped me to realize how important it is to do a full review of everything happening with a patient so that you know how to help them best and to provide a complete holistic plan of care for them. This also helps to build a better relationship with your patient because they trust you and they believe that everything is going to be okay and you're not going to lie to them or anything. Thank you, everyone. I hope you enjoyed my video.